welcome. Many thanks for joining us on yet another edition of our program, Stop the Accidents, a platform where together with you and all stakeholders, we put heads together and find ways in minimizing accidents and reducing numbers of needless fatalities. I'm Kunle Aburoshade, and we've got a good show for you this afternoon, and we are going to look at the issue of meningitis that is ravaging some parts of our dear country, Nigeria. And let me let you know that Ehi Iden, our safety analyst, is already in the house in our studio, and together we will take a look at how and what is happening and what can be done to curb what menace of meningitis. That's our agenda this breezy, cool Sunday afternoon. We'll be right back.
Now you have a voice. Now you have the platform. Now let it be our collective responsibility to stop the accidents. Stop the Accidents beams its searchlight every week on the issue of safety and how to prevent accidents at the workplace, in our homes, on our roads, and on construction and building sites, and other accident-prone settings. Join Timiduro Dola and Kunle Aburoshade as they investigate and talk to experts to bring you safety scoops every week. Stop the Accidents on NTA.
The road signs means a solid red and then black cars which are allowed to cross that side.
Water.
Hello?
What does this road sign mean?
I mean, the road sign name Snake Day, the roadside.
What does this road sign mean?
This road sign meaning police know the area, so everybody go fit do whatever he like.
All right, welcome back. If you're just joining us, take a seat and relax on Stop the Accidents this afternoon, and we are discussing meningitis and all you need to learn to keep yourself safe, from this deadly bacteria and virus infection. And across Nigeria, that on the last count, about 16 states, and one or two cases in Lagos. But to do justice to that, I'm being joined now by our safety analyst, Ehi Iden. Welcome to Stop the Accident. Good to see you again, Ehi. I know you're a very, very busy man, going all over the place, but as always, we are so privileged anytime that we call on you and you are here. Welcome.
Thank you, sir.
Okay, fantastic. Meningitis. A lot of people, millions of people, sometimes maybe some have read, some have had meningitis, but a lot of people don't know what is meningitis.
Meningitis is actually an inflammation of the membrane, covering both the spinal cord and the brain. Okay. And when that coverage gets inflamed, then you have meningitis. And it could be caused by both bacterial, viral, and viral infection. And this broke out in Nigeria by November this year, November last year. Okay. And from the last CDC report, it has spread to about 16 states right now.
So that is serious.
Including Federal Capital Territory. And we have recorded over 8,000 infected cases. Okay. And it has recorded about above 800 mortality as of today.
That is serious.
And the upper week alone, we had 250 new cases. It means this is really prevalent and should be described as a national medical emergency.
Okay. All right. So we get that sorted out. Is a national medical emergency. What should be the immediate response now?
I think one of the things we should be doing right now, owing to the fact that the type C meningitis, which of course is the outbreak we have currently,
Okay.
It's very new to us. What we've had outbreak of meningitis in this country is not new. But what we've always had is the meningitis type A. It's the first time that the country is recording meningitis type C. That's why when you had the first...
Which one is deadlier, type A or type C?
They are both deadly. It depends on where they are both deadly. It depends on the outbreak you have at any given time.
Okay.
When the outbreak of C came out, people didn't really know what it was. They thought it was the regular A that we had available. Okay. So you found that in those meningitis bed region, they started immunizing people with meningitis vaccine for type A. What you actually had was type C. Until analysis were done, found out that it was type C. That was why you had issue where we heard that the country was short of vaccine because we were not prepared for it. We didn't have vaccine for type C. So we had to start importing vaccines in
for type C
to counter the virus. But outside that, we should be able to actually create a lot of health information centers. When disease breaks out in the country, what I think should be the first thing that we do is actually profile the disease and create disease information centers where people can actually walk in
and learn about what's happening. We can get information about what's happening.
That is what we're not having, which of course is very pathetic. In each state there should be disease when people can actually walk in. There are people that are there to educate them on this disease, because when you have information at your disposal and you walk around, you see the symptoms of what you were told, you are able to identify it, and that's an early intervention.
That's key.
It's very key.
That's key.
We are not having that, and that's where we have problem. We need to start putting this in place. Because we go about doing our advocacy, we find a lot of people still do not even know what meningitis is. You can't blame them. So there's still huge information deficit. But what we should really be doing is try and avoid crowded environment at the moment.
Okay.
Try and err.
That's what I was about to ask you. What is the transmission mode really? How do you get it? From an affected person to an elderly person. What's the transmission mode?
Sad enough, it's very contagious.
Okay.
It's contagious, and you can get it. You can get it through people mingling together. Okay. And that's why we propagate that schools are resuming. Children should have been vaccinated before sending them back to school. You have children playing and they have droplets, and other children have contact with those droplets. They stand the chance of contacting meningitis. So it's contagious. You can have somebody who droplet of somebody that falls on your skin, and by chance you actually have meningitis infection. So we have said we should avoid crowded environment. Learn to air your room, create more ventilation in your environment, in your rooms, in your home, so that people can actually have enough air, and avoid areas that are unsensitively too hot at the moment. So these are some very key issues. And above all, try and go and take the immunizations in any government health centers or hospitals. Okay, are
those available? All right. Okay. Well, we'll take a break now, but let me let you know that Dr. Bola Akinfala is a public health expert. Will join us on the other side of this conversation, and then we can actually also get even more facts from him and the situational report, as it were. All right, it's a stop the accidents. Our agenda always to be on top of what is happening to keep you safe in all ramifications. And we'll be right back after this break.
Now you have a voice. Now you have the platform. Now let it be our collective responsibility to stop the accidents. Stop the Accidents beams its searchlight every week on the issue of safety and how to prevent accidents at the workplace, in our homes, on our roads, and on construction and building sites, and other accident-prone settings. Join Timiduro Dola and Kunya Borishade as they investigate and talk to experts to bring you safety scoops every week. Stop the Accidents on NTA.
All right, well, if you just joined us, take a seat and relax and listen to this key information that we're about to pass to you, and very, very essential information. And well, we have been joined by Dr. Bola Akinfala, public health expert, to throw more light on meningitis that is spreading across the nation. Dr. Akinfala, welcome to Stop the Accident. Thank you for coming. And well, no time, so let's quickly go about it. Okay, some people say meningitis. How do I know somebody has meningitis? What are the presentations?
Okay, first and foremost, it affects all ages. So bearing that in mind, different age groups present with different ways. In infants, they tend to be febrile, irritable. Some of them can come down with convulsions. They are very lethargic, that's very weak. Some vomit. But in the adults, similar symptoms, but they tend to be more photophobic. That means they are very sensitive to light or sun to sound. Fitting, convulsions, like I already said. Neck stiffness is quite important too. And before it progresses to complications, if not treated. Yes. So is somebody watching us now and noting down these presentations now, so what should they do? He's told us some of the steps we should take. Avoid the public places where there are a lot of people crowded, ventilation and all of that. But you know, somebody watching us now, Dr. Akinfala, what will you tell that person? He has already said some primary preventive measures that person can take. Those are quite key. And bearing in mind, if you know or if you have this similar complaints, presenting complaint, I think the person should actually go to the nearest hospital to present himself for a thorough screening. And then the doctor would decide, really, we investigate further to know if the person has meningitis or other differentials like malaria, because they actually look alike. So
all right. Can they go to any hospital? Can they? Or are there specialized centers for this, or you can just walk in to any hospital?
Preferably a specialized hospital, a secondary facility of the tertiary. Yes, sir.
Yes, sorry. Let me quickly throw that he was just about. You mentioned it. Let us understand that meningitis presents the same symptoms that you actually have fever, like you're having malaria. So don't stay at home or water it down when you have excess fever. It's important you run to a facility, you are diagnosed and it's not meningitis, than mistaking malaria for meningitis or malaria, and you find that you just manage at home and you get to a very critical position. So it's important.
All right. So on the issue of vaccinations now, what is the situation report now? Are the vaccines available? How can millions of people watching us and who wants to, protect themselves, how can they have access to these vaccines? Can they just walk to anywhere? Are there also specialized places where the vaccines are now available?
Well, the vaccines are available right now because when they first started, there was shortage of vaccine. But I think government has made a very giant stride in bringing in vaccines to the country. And you can get vaccines in most of the public hospitals. There are centers, there are vaccines in those places, and even private hospitals, and I think they're having vaccines. So the vaccines are available, and that is the best.
That's great news. That's great news. So you can access these vaccines and protect yourself. It's so very, very important that you protect yourself because you never can tell where you will get it. People will still go to church. People will still go to mosque. You can't stop them from going to church and all that. So he's saying avoid all those public places. Maybe you can avoid some, but there are some others that no matter what, people will still go there. So
let me also throw this in. Knowing how diseases travel. People in areas that have no meningitis index yet should not just be lackadaisical and think they wouldn't have it. When we were faced with Ebola in Nigeria, it was only one man that left Liberia that came to Nigeria and put the whole country in trouble.
At risk, yes.
Now we have the meningitis bed where we have most of the northern states already affected. People travel at random and they come back to where they travel from. You never can tell where someone went to that's coming to your home, where someone went to that's your colleague in the office. So I think the best thing we can actually do to ourselves is don't take it for granted. Don't wait till you get hit by this thing. Just run to a facility right now, take the immunization, and ensure that you are free, even if you have contact with somebody who has meningitis. Because disease travels so fast, because people are migrating, in a faster rate than it normally was.
And it's also very important that now at least the right vaccine has now been identified.
It's available right
so
now.
once you take this vaccine now, you are taking the right vaccines. From tomorrow, take the advantage of the holiday. Just go and take the vaccination. It won't take you anything, and it doesn't cost much.
Yes, the government has really subsidized it. It's almost at a no price, less than 1,000 or two. It of course is very critical.
All right. How about treatment for those who are already infected?
There is treatment, but I think there are
in addition to what he said, bearing in mind that the school children just resumed, and who knows where they went to spend their holidays, maybe in the north. I think all school children, because this case is quite it's very common among those within the ages of 5 to 14.
Okay.
So I think all school children should be vaccinated. So it's very, very, very important. And also know that most of our public schools are overcrowded and
overcrowded.
So as regard treatment, if you have those symptoms and signs, definitely go to a nearby health facility
as quickly as possible.
A doctor will be in hand to attend to you, will likely isolate you, inform the right authorities about it, but pending, and also carry out some basic investigation, but pending that time, very important, the commonest cause is bacteria, and that's the most dangerous. So the doctor definitely will give a parenteral antibiotic. It's very, very important. The dosing, I don't think this is the right
forum to do that. So the important thing is to assess a medical facility with qualified personnel there who will undo that treatment and put you on that
and inform the right authorities, because it's a breakout. It's a must watch out for.
All right.
Let's quickly also add the simplest form of infection control is hand washing.
Okay.
Yeah, as much as possible, as much as we can. Let's go back to the culture of hand washing. Wash hands with water and soap lavishly, because you never can tell what was the last thing you touched or who was the last person you had contact with. If you control this infection to a very if we actually manage the control properly, the fatality from meningitis death actually is less than 15%. Managed properly. So
but even 15% is high.
But if we manage properly, but if I tell you, if we don't put this process in place, you can have a fatality or mortality as much as maybe 20-25%. So let's just try and do the right thing. So
hand washing. I thought that from the infection, the Ebola infection, that Nigerians have learned the culture.
we did. In all honesty, we did. You know the kind of country that we are. When Ebola came, we all realized how much we value our life, and everybody you saw
started washing hands,
sanitizer. As Nigeria was declared Ebola free, we went back to our normal culture.
So please, washing hands, not just for preventing meningitis, a whole range of other diseases.
Let it be a lifestyle.
That's just washing your hands can take care of. Okay, now as we round off, we know that many of you are trying to reach us. I will not take phone calls today, but I know you have so many questions, and can you commit to coming back next week to answer questions? Because so many questions that the millions of our viewers want to watch.
Yeah, we can do that for next week.
Okay,
it's fine.
Fantastic. So that's a promise. So next Sunday at 1:30, we'll keep the lines open for you for all the questions you want to ask Dr. Akipala and Ehi Iden. They will provide all of the answers for you.
And sorry, and that will also be an opportunity for us also to give you the latest data if there is increase in the infection rate and mortality. So we'll just be able to update you what has happened. From this time till next week.
But right now, 8,000 infections and counting.
Yes.
And over 800 mortality already. It's frightening.
It is frightening. That's already 10% mortality.
You know, because for all of the noise about Ebola, the fatalities were,
yes,
I mean, not in this.
You know why that happened?
Yes.
Because Ebola came to Lagos.
Okay.
Lagos seems to be the state that is ever ready for this kind of surge. But you find out that the meningitis, it crept in through the meningitis beds, which of course is the northern region.
Yeah.
So I mean, the last time I actually listened to the governor of Zamfara State, he was actually lamenting he needed about 3 million doses of meningitis vaccination. All that he has received as at the time he was giving the interview was about 300 doses. He only got 3 pieces, the 10% of what he really needed to vaccinate these people. So I mean, but I think as of today, the vaccines are everywhere. He should be able to get.
And also, in addition, also let us remember that the IDP centers are located in the north.
Okay, yes, yes. And that's a very, very crowded environment and a hotbed for transmission of contagious diseases. All right, we see our phones buzzing. We tell you that they are committed to coming next week. So don't just bother to call today. We take all of the questions together next Sunday. Okay, closing statements for now. Let me start from Dr. Kitala, and then Ehi will round up.
Okay. Well, meningitis is real. You've said so much about it. I think you should be educated more about it. You can go and read more about it. Watch out for people around you. Hand washing is key. If you're going to call for sneeze, use your elbow preferably. Don't go around. And watch out for your children. They are quite key. It's quite common among adolescents, and also it's a death sentence. We don't want it to progress beyond where it is now. So
okay, and quickly let me ask you, will you advise that sick kids are kept at home for now?
No.
They should go to school.
Yeah. No, they should
not go to
the
school.
hospital.
They should be taken to the hospital.
And all schools should please do pre-resumption examination.
All right. Okay, 30 seconds.
Yeah, like he said, sneezing is not just sneeze at people. Sneeze this way that like the way he said.
Yeah.
Hand washing is very key, but you must understand that we can only manage infection to the capacity of information we have at our disposal. Okay. Let's seek more information on this.
And that information you will get next Sunday. The experts are committed to coming and taking your questions, and then so you call and ask those questions, and they will be glad to answer those questions. I'm Kunle Aboro Shade. We'll be here next Sunday by the grace of God. Have a fantastic Sunday. Bye bye.